Hey everyone, in this lecture we're gonna go over exercise and the immune system. And so when it comes to that, there are some basic things about immunity we need to cover first. So realize there are um, immune mechanisms to protect us from a lot of different things like bacteria, viruses, even fungi. And so the key components of our immune system are our cellular and chemical responses. Um, and those kind of break up into our innate immune system and our acquired immune system, or our adaptive and specific community. So, innate immune system is that specific protects against a lot of things, where our acquired immune system really is about identifying certain things and defeating those on a very individualized basis. So our innate immune system covers things most people don't realize. We have physical barriers, like our skin is part of our immune system. It's keeping pathogens out. So are your mucosa, your membranes in your mouth and nose and in your digestive tract. Um, and so then beyond that, we start getting into more of the microscopic things that are helping protect us. So things like phagocytes, which are usually our main ones are macrophages, which are located in tissues, and these produce cytokines to stimulate the immune response. And so you're going to see this a lot of our immune system releases these cytokines in order to increase the other systems that are helping with that immune response to get rid of cells and kill them. You also have neutrophils, which exit the blood to enter tissues. So you see you have them in tissues, you have some floating in your blood, so we can get that response exactly where we need it. And then one of the coolest ones to me as part of our immune system is what we call natural killer cells. And these destroy viruses and bacteria and even cancer cells. Most of us have had a cancer cell in our life, and our body actually has already defeated that. Natural killer cells kill that cell, it recognizes as bad. And just take care of them. And these will kill any kind of foreign cell in the body, one that doesn't recognize. And they also give off cytokines to increase that immune response. And so this is a little diagram that shows our innate immune response and kind of where those may be and how those components go together. This I'm not as worried about. It's just showing you how there's one stem cell that all of our kind of immune response cells come from. And so when we talk about this immune system, we do have what we call complement system, which really is there to help our immune system along. And so think about these kind of things that help identify or help get rid of bacteria, viruses, things like that. And so complement proteins attach to the surface of a foreign body. So think about a bacteria, they attach to it. They destroy bacteria by making little holes in the surface, so they attach to them and poke little holes in them. So basically everything leaks out and they can't survive. They also tag those surfaces in order for phagocytes to be able to engulf them and then basically digest them. So you have cells that will eat bacteria cells, digest them to get rid of them out of your body. And then they also will attach and be like an attractant. So they'll basically signal for your immune cells to come that way, so they can recognize them to either poke holes in them or to just kind of eat them. And so this is kind of a chart that goes over the different leukocytes that we have. So you have many leukocytes, and so it talks about where they're produced, whether they're innate or acquired, which we'll talk about acquired here in a minute, their functions. And so these are just some good charts to kind of look over that kind of start helping you to differentiate between the two and what they may do. And so we get into B cells and T cells, which are our acquired immunity, which we haven't really said much about yet. And again, my favorite, the natural killer cells. So our acquired immunity or adaptive immune response, basically when the first time they see a particular bacteria, virus, whatever that is, they don't know what it is. And so the acquired immunity, after you're exposed to it, will then make some things that help recognize that particular invader, if you want to call it that. And it helps to remember certain pathogens along the way, so that if we ever come in contact with it again, it can basically defeat it before it really makes us sick. It quickens the response so that basically we can get rid of that bacteria, virus, whatever that foreign agent is, before it really causes us any harm. And so the major cells we have there are B cells and T cells. and related to those B lymphocytes and T lymphocytes. So our B cells will secrete antibodies. And so you've probably heard of antibodies before. And antibodies are also called immunoglobulins, and there are multiple types, immunoglobulin G, A, M, D, E, probably even more. And they help to fight against foreign antigens, so foreign proteins. They're really helping to fight those, again, basically tagging them and then trying to group them together and then basically digest them, break them down. And so antigens stimulate that immune response to produce antibodies. So basically it's kind of like, ooh, we see this, it's not recognized in the body, this protein, and so we're going to cause all of this to happen. Our T cells recognize those protein antigens as well, and they will then produce, once they recognize it, killer T cells, which are cytotoxic T cells, which kill viruses, virus-infected cells. So viruses get inside of a cell and kind of take them over, and once that happens, that cell is no good to us, and so killer T cells will basically isolate that cell and then kill it off so we don't have to worry about that virus replicating and then spreading to other cells. There are also T helper cells, which give those cytokines to help that immune response to help fight this and increase the production of our B cells and T cells and all the other things that help us fight it, like natural killer cells. And then we have our regulatory T cells, which are really good because they are going to healthy cells and basically saying that, hey, this is a good cell, we need to keep this one, don't attack it, don't kill this cell, this is part of our body. And so we have those going on. And then as part of that, we always want to talk about inflammation. Inflammation is just a natural part of our immune response. And so we have acute and chronic inflammation. Acute inflammation is in response to injury. So think about cutting your finger, very short-term response. You have vasodilation, which increases blood flow to the area, basically to get these immune cells in so they can make sure that we don't get an infection, that bacteria and viruses don't get in and start taking over the body. And so that blood flow increases, we get the swelling, and that can cause pain because of those kinins coming in. So that is part of the reason it hurts when things are swollen and inflamed for a little while. And typically after a day or two, that goes away, make sure all the foreign agents are out and killed, and the healing process starts. However, we do have chronic inflammation as well, and this is where we have that inflammation for more than a couple days. It can be due to a persistent infection or prolonged immune response caused by something that maybe isn't an infection. So this increases the circulation of cytokines and C-reactive proteins to help, again, fight viruses and bacteria. High-grade inflammation is one category. This is usually caused by certain cancers or rheumatoid arthritis, and so it's whole body inflammation of a lot of joints, a lot of pain all over because of all those kinins. And then you have low-grade inflammation, which doesn't cause issues that are noticeable maybe on the outside. The person who has this low-grade inflammation isn't going to be experiencing a lot of pain and issues from it and even maybe notice it. But it increases your risk of things like heart disease, cancer, diabetes. It makes all of your body work a little bit less efficiently and leads to long-term chronic diseases. So aging and obesity is part of this. So when it comes to exercise, well, how does that play a role? Well, exercise can help with our immune system response. But it's not going to be anything like if you exercise, there's no way that you can catch, like some big disease, like let's say tuberculosis. It's not going to prevent you from catching that or prevent you from catching other diseases like malaria. But what it will do is it'll strengthen your body, to fight maybe that particular virus or bacteria, whatever that comes in. Your body is stronger, so it's better able to fight that. But what we have been able to prove with research is the fact that exercise can have a negative and a positive effect on upper respiratory tract infections. So anything in the upper respiratory tract, so think of those days where you have a cold or the sniffles, any kind of infection in that area, we actually have seen exercise have improvements and negative effects on that. And so people who engage in regular activity and exercise are at lower risk for upper respiratory tract infections. But the risk is higher in people who don't engage in any activity and those who engage in long duration exercise. And so this makes for a J-shaped curve that looks like this. So you can see risk of infection average for sedentary people. As we exercise a little bit, it goes down, but if we exercise too much, we actually have an increased risk. And so regular exercise, usually we say 20 to 40 minutes of 40 to 60% of VO2 max, can decrease your risk of upper respiratory tract infections by 18 to 67%. It's a really big range, but there is some protection from it. Resistance exercise may also be beneficial. There's just not as much evidence for that. And so the way we think this works is that we boost your immune system, so natural killer cells, neutrophils. These do return to normal after about 3 hours from exercise, but we also know that exercise helps to lower emotional stress. You usually eat better. You also get more sleep. And so they compound together to give this extra protection. And so is exercise really good or bad for our immune system? Well, it's kind of this, some things it tends to be, especially in moderation. High levels may not be so much so, but it's kind of hard to tell. We do know that as you get older, your immune system's response decline. But with moderate exercise, you can actually improve your immune function. So enhance vaccination responses, increase in T cells, lower inflammation cytokines, increase phagocytosis, which is breaking down those bacteria and viruses. And so we think that exercise is a friend of the aging immune system, that it is going to be beneficial, especially in that. But again, moderation, because think back to that J curve. So we do know that high intensity, long duration can increase your risk for infections. So prolonged exercise is considered usually greater than 90 minutes. And there may be a short depressive effect in our immune system when people exercise like that. And so you see a decrease in B and T cells, natural killers, neutrophils, immunoglobulins, anti-inflammatory cytokines, you see more of. And so there's this term open window for increased risk of infection. So if you do long duration activity, there's a window where you're more susceptible to having an infection because these levels have changed and they'll return back to normal. And we're not exactly sure why this is. It could be sleep, mental stress, who knows? But what this open window theory looks like is something like this. So the dashed line is your natural immune kind of response to the normal. When you exercise, we see that small increase, but after we exercise for a while and we stop, we see this decrease for a few hours where you're more susceptible to a immune response, and then it returns back to normal. So it's just something to keep in mind because it could leave you a little bit more susceptible. And so these are all the factors that may make it where you're more susceptible to an infection. So one thing that kind of comes up is how exercise and your immune system respond to maybe different extreme environments. So is working out in the cold, maybe people think, they've heard things, old wise tales of wet hair and being out in the cold makes you get sick. Well, how do these things play into it? Well, with exercise in a very hot environment, there's no real impairment into our immune system, so we don't have to worry there. We also see that there's no negative effect in the cold, so extreme cold and exercising, there's no increased risk for infection, so we don't have to worry about that. And even at high altitudes, we tend not to see an increased or an impairment in your immune function in a controlled setting, but actually out in an environment. So if we just send someone out at 6,000 feet out into just the natural environment and not a lab, there may be a slight increase to upper respiratory tract infection, and that would tend to come from you're having to ventilate more, and so you're more likely to take in some kind of bacteria or virus from that. Remember, we talked about altitude a little bit and the pulmonary system, and now we would have to breathe more if we were at altitude. So at the end of the day, what about if I am sick or I think that I'm sick? Should I exercise? Should I not? Sometimes maybe you've been sick and you've exercised and it actually made you feel better afterwards. And so there are some common rules when it comes to exercising and when you have like a cold, which is typically what we're thinking about when we have those days we don't feel good and we're not sure whether we should exercise or not, is when we have a cold, not when we can't get out of bed. Of course, we shouldn't exercise then. So typically it is if your symptoms are above the neck, runny nose, nasal congestion, mild sore throat, you can exercise, reduce the intensity and the duration, you're perfectly okay. If those symptoms are below the neck, so chest congestion, cough, stomach pain, you should refrain. Definitely never exercise if you have a fever, if you're already fatigued, or your muscles are already achy. And so that covers our immune system, response, and exercise.